video specifically to our wonderful YouTube crowd, all of our subscribers. So we posted 2 days ago. We posted a video which a patient who came in with 2 different ulcers of the great toe. It was the angry toe, and a lot of people were questioning the reason why, we weren't using, why we didn't anesthetize the toe itself with an actual injection. Let me make this clarification here once and for all. This patient has advanced Alzheimer's, number 1. Number 2, severe advanced dementia. It is just like a pediatric patient who has autism. These patients are very, very brittle, right? These patients we have to handle with a lot of TLC and a lot of care. So injecting or performing an injection on these patients is, number 1, extremely traumatic. Number 2, can be very dangerous more than anything, because they can become also very combative. And I've seen it happen, instances where we are actually numbing, we're trying to numb using an injection, and the patient or pediatric patient, they abruptly move their foot, and when they do that, believe it or not, the needle itself can actually break inside the foot, and that's a big problem. So, when we're very, very mindful, and we make those decisions based on, obviously there's 3 sides to every story, and we base our decisions obviously based on, it's something multifactorial. It's not just what everyone sees, which is the doctor debriding the ulcers, and everyone hears the patient maybe a little bit uncomfortable, or hears a little bit of moaning, and there is even with topical lidocaine or any other type of anesthesia, when there is active infection, these topical medications, they're not very effective because of the pH, right? And the infection doesn't allow whether it's injected local anesthesia or topical. So I hope I haven't confused anyone, but I just wanted to actually not necessarily it's more education than anything. So with that said, I'm going to go ahead and grab the camera from here. The patient is doing excellent, actually. So let me just get a clear picture here. There we go. The medial ulcer is definitely smaller. The toe is definitely not as angry as it was the other day. Okay, the patient's on antibiotics. As everyone can see, the cellulitis has decreased, I would say easily 50%. Let's take a look at the lateral aspect here. It's very, very superficial, right? We de-roofed this little blister that was on the lateral side. But all in all, the patient is doing very, very well. We're going to keep a really close eye on this patient's progress, simply because of some of the underlying comorbidities, including severe vascular disease. This patient does not have any diabetes. Some people were asking as well. So, more than anything, I just wanted to give everyone a thorough explanation, and of course, a follow-up video on how this patient is doing 2 days after the first time we saw her. Okay, which was Tuesday. So like always, www.jawspodiatry.com, Instagram Dr. Tojam, Jaws Podiatry Facebook, and last but not least,